I'm Professor Andrew Taylor. I'm the Professor of Cardiovascular Imaging here at UCL, and I'm also the Divisional Director of Cardiorespiratory Services at Great Ormond Street Hospital for Children. One of the projects that we want to do that is a collaboration between UCL and Great Ormond Street Hospital for Children is to use MRI to assess wave intensity analysis using image analysis techniques. We want to do this in patients with heart failure. Now, heart failure is one of the most common conditions that affects patients with cardiovascular disease, particularly in older patients, but also in children. For some patients, their heart actually pumps normally, so the contraction of the ventricle is normal, but they still have the symptoms of heart failure, shortness of breath and shortness of breath when they lie flat. Now, for those patients, we often need a cardiac catheterization to assess exactly why they still have the problems and the symptoms that they present with. Now, over the last few years, we have developed techniques, particularly wave intensity analysis, which we can do on MRI images, that can assess which patients may have this problem without using or without the need for a cardiac catheterization. And Giovanni will give you an overview of the engineering aspects of this project.
I'm Giovanni Biglino. I'm a biomedical engineer and I work at the UCL Institute of Cardiovascular Science as a research fellow sponsored by the National Institute for Health Research. This project concerns extracting wave intensity analysis from MRI data. From an engineering point of view, I see three main parts in this project. The first one is about an analytical component to maximize the amount of information that can be extracted from the imaging data. The second is a strong image processing component to optimize the way in which the analysis is done and the actual MRI data is analyzed. And the third that we have the advantage to do by being based in a clinical center is the interaction with clinicians. So identifying the most interesting patients to be analyzed with this technique, demonstrating the usefulness of this non-invasive method. This could be eventually integrated into a user-friendly package to be used clinically. And once the reproducibility and the validity of the method has been demonstrated, hopefully during this PhD, this could be used in clinical practice every day with patients.